Hey guys, it's Doc Heps. Have you been noticing something changing with your erections? Maybe you're noticing some curvature, some pain. Well, we're going to talk about Peyronie's disease. We're going to tell you what it is, how to diagnose it, and how we treat it. So stay tuned. Hey guys, it's Doc Heps with UroCoach, realurology.com. So we're going to talk about Peyronie's disease, a very common problem in many men. It affects 1 out of 10 men, mostly in their 40s. I'm going to talk to you as if I'm talking to one of my patients. What is Peyronie's? How do we diagnose and how do we treat it? So let's start off. So Peyronie's disease is a problem of the tunica albuginea. That's the casing that contains the blood of the penis. Now, as we achieve an erection, blood flows into the penis, and there's that casing I mentioned that contains that blood. Now, if that casing becomes scarred, we'll call that a plaque. So that scar tissue causes inflammation, it can lead to pain, and it causes a thickening in a certain area. So imagine if you're filling up one of those long water balloons. Now, if that water balloon is all evenly distributed, the plastic of it, the rubber of it, then it will extend very straight and even. If a portion of that balloon is thickened, then that balloon will curve as it fills. The same thing is happening with the penis. Oftentimes that scarring develops, and we don't know exactly why it develops, but the theory is microtrauma. Sometimes men will have a bending accident during sexual activity that causes some scarring. Most guys don't have any remembrance of any significant trauma, but we think that maybe consistent so-called microtrauma causes this area to fibrose. It can be on the top side, and that will affect how the penis curves. Now, Peyronie's disease is generally divided into 2 phases, the acute and chronic phase. The acute phase usually lasts about 6 months, and that's when the curvature develops, the plaque develops, and the scarring develops, and you can have some pain. Usually by 6 months or so, that pain resolves and the curvature stabilizes. So how do we diagnose this? Usually by exam and by history. We'll talk to you about what's going on. Sometimes we'll ask you to bring in a picture, or we'll create an artificial erection in the office to get a better sense of the exact curvature of the penis. And then we'll do an exam to feel for that fibrosis or that scarring, that plaque area. That's a hardened area you may feel within that casing, that tunica albuginea of the penis. Now, treatment. Well, a lot of guys just need some reassurance. They need to know that nothing bad's going on. It's not an infection. It's not cancer. And then there's non-medical treatments, which include traction devices to try and straighten the penis. There's vacuum devices which also work the same to try and straighten the penis, and they've shown to have some benefit. Medical treatments include something called Xiaflex, which is an enzyme that is injected into that plaque, that scarring of the penis. That includes 8 injections. It's given in 2 injections each round every 6 weeks. So that's a process that works for a lot of guys and probably is the only effective medical approach. Now, beyond that, there's surgery. So that includes plication, where we kind of bend the penis the opposite direction, or removing that plaque and placing a graft, all kinds of different creative ways to try and create an effective erection. And lastly, another surgical approach, if you have significant just problems achieving an erection, would be a penile prosthesis. So there's a lot of options. Most times men will feel reassured that nothing bad is going on, but see your urologist if you're having an issue. Don't be afraid. This is a very common problem for many men. Hopefully this helps guide you. Check out our other videos. Thanks for watching.